we're going to talk about how do you know if you are in or out of alignment. There's some preliminary checks that you can do in your own home or household that you can look for on family members or yourself. One of the things you can do is you can actually look in a mirror, a full-length mirror preferably. Look at the level of your shoulders, close your eyes, turn your head to the left, to the right, back to center. Open your eyes without moving your head, and then look at your body. Look at your position. Look at the level of your shoulders. Look to see if your head is leaning in one way or the other, if your head is rotated in one direction or the other. Look to see if you have one hip higher or lower than the other, or if your body is off-center. In other words, the center of your chest should be centered over the center of your 2 feet. And if you find that you're deviated off of that center position or midline position, then it is a good indicator that you are subluxated or out of alignment. And as we've talked about in previous educational videos that you'll see on our online, when this first vertebra, the atlas, misaligns, it affects the extensor musculature on one side of your body relative to the other side. So what will happen is when you lie down, one leg will be longer or shorter than the other. And that's one of the checks we do here, and that's called a leg length insufficiency check. It's a little bit of a tongue twister. And what we're looking for is we're looking for postural deviation with that. So, and that's called a physiologic short leg versus an anatomic short leg. And there's a lot of debate about physiologic versus anatomical short legs. People oftentimes say, well, Dr. Barone, isn't it normal? Doesn't everyone have a short leg? And the answer is 95% of adults do have a short leg. But what causes it isn't the fact that the bone's shorter. Most of the time it's because the muscles are tighter on one side of your body versus the other, and it's making the leg appear shorter. When we correct the atlas vertebra back relative to your skull, it normalizes the nervous system, the hips level out, the muscles balance, and the legs come even again. And that happens in probably 95% of the cases. We believe that there's about 1 out of 200 that are anatomical short legs, which is very contrary to what a lot of other people teach out there. So we found about 1 out of 200 patients have a true anatomical shortness. That is the only time that you should ever put a heel lift in your shoe. If you put a heel lift in to correct a physiologic short leg, what will happen is you will make the problem worse. And you're putting more stress on the nervous system, more stress on the discs and the anatomy of the spine, and it actually will create more nerve pressure, which will create more pain and dysfunction throughout the body. So it's really, really important that if you have a physiologic short leg, that you get an atlas correction by someone that knows what they're doing, and then get that normalized so that you can allow your body to heal and function as it's designed to function. And remember, your posture is an outward expression of how healthy you are on the inside. And as I always say, don't let friends, or I should say, friends don't let friends stay subluxated. So get your friends and your family members checked as soon as possible so we can make sure that your friends and family are living subluxation-free lives so that they can function and optimize their life in the way that they were designed to. Have a great day. Until next time, I'm Dr. Barone.